You're listening to the ADHD Heroes Podcast, a podcast where we speak with the heroes of the ADHD community, namely educators, mental health professionals, and of course, those with ADHD themselves, to gain insights, tools, and most importantly, inspiration towards succeeding and thriving with ADHD. I'm your host, Rabbi Shmuel Reich, a high school Rebbe and an ADHD coach in private practice. Welcome to the show. Hi there. On this week's episode, Dr. Lancer Naghdechi was back, together with a business partner named Yaffa Gordon, to discuss a program they run together. We discussed the nature of their program, in which they help families navigate treatment of ADHD, including coordinating with different professionals such as doctors, therapists, and ADHD coaches, who are awesome, educating families about what resources are available to them, addressing comorbid conditions, supporting parents and siblings, working with schools, and a lot more. Also, the ADHD Heroes podcast is now on YouTube, along with short clips from the episodes that can be found on YouTube Shorts. So if you can check us out there, give us a like or two, that would be great. Before we dive in, I'd like to tell you about another podcast I listen to called the Chinuch Today podcast. The host of the Chinuch Today podcast is former ADHD Heroes podcast guest, Rabbi Yerachmiel Garfield, Manal of Yeshiva Torah Semes of Houston, Texas. Rabbi Garfield interviews a wide range of creative thinkers who are already implementing their valuable innovations in the world of education. So whether you're a principal looking for new ideas, a classroom educator looking for inspiration, or a caring parent looking for hope through what is coming down the pipeline, the Chinuch Today podcast may be for you. If you'd like to take out an ad for your product here on the ADHD Heroes podcast, you can send us an email at adhdheroespodcast@gmail.com. Enjoy! Dr. Lancer Naghdechi and Yaffa Gordon, welcome to the ADHD Heroes podcast. Dr. Lancer, welcome back to the ADHD Heroes podcast. Looking forward to our conversation today.
Likewise.
So Yaffa, a little bit about yourself and your background.
Sure, absolutely. So I'm born and bred, second generation Floridian.
Oh, wow. Okay.
Yeah, born in Miami Beach, grew up in Boca, and have lived in North Miami Beach for about 20 years now. I grew up, my father is a local pediatrician. He's like the pediatrician of the community. So I grew up with pediatrics and caring for people and caring for patients really in my blood.
Awesome.
So thank God. I actually, after high school, I went to Israel for the year, and then I came back and I worked for Project Extreme. I went on their summer programs for a couple of years, and I worked a lot with teens at risk and teenagers in general. I ended up going to school for business and not doing anything with it, maybe until now, but I ended up teaching in a high school for a couple of years, and realizing that I really liked working with kids. I didn't like the discipline part. I didn't want to tell them that they had to take away they had to put away their phones or they had to leave the classroom. But I knew that I loved education. I knew that I loved working with kids. So at that point, when I was trying to figure out what exactly I wanted to do, my father said to me, why don't you go back to school? Why don't you go to PA school? Why don't you go into pediatrics? You'll work with me and we'll figure it out. So I did. I went back to school with two kids. My kids at the time were 4 and 2. My husband was amazing, extremely supportive, went through PA school. And after that, started working in pediatrics for about 8 or 9 years. Worked in corporate, patient care, seeing patients, 40 patients a day, over 40 hours a week. And through that process, I learned what I liked about pediatrics, and I learned what I was good at. Aside from well checks and sick visits and, looking in ears, and 90% of what we do is working with parents, I realized that I really had an interest in working with kids with behavioral challenges. A lot of the doctors at the time, it takes a lot of time. It's hard for them to sit and go through the medication management and make sure there's support for the families, give them the right resources. We had a very short amount of time to be able to see patients and do all that. But I did it for many, many years. Personally, and my son allows me, he gives me permission to talk about him. I have a beautiful 15-year-old son. He's my oldest now, who has ADHD and is on his own journey, and he takes us along with him. And so really professionally and personally, I moved into a space where I realized this is really something that I had a passion for, that I really could help people. And, we ran with it.
Awesome. Good for you. That's a great story, and sounds like you really found something you're passionate about. Awesome.
Yeah.
Okay, so when did you team up together?
So um, I was working for a different pediatric concierge practice for a year or so, and Dr. Lancer was moving down to Florida, and he was networking, kind of seeing who was out there, who were the pediatricians. And he came across my name. He reached out to me. And at that time, I was like, well, I don't know what I'm doing, but you're more than welcome to speak to the other person that I'm working with. I don't know if that ever panned out. And then a couple months later, he called me back and was like, hey, just checking in. And I was like, well, I have this vision and this idea that I've had for many years. And he's like, I also have a similar vision. Let's team up together. Let's pair up together. And obviously, we'll talk about our vision, today. But that's really how it was. It was a phone call and it was like, hey, can we work together? You think we can make this happen? And we were like, okay, let's try.
Whoa, that's cool. Dr. Lancer, where were you coming from? Where were you coming from?
From New York. So, I've been around. I'm native to Florida. I was born in Fort Lauderdale, but I grew up in LA, and then
Right.
I did some training in New York, New Jersey, Chicago. Finally came back down here.
Got it. So it was on your way back to Florida from New York, and you've just both had similar visions, and I'd say the rest is history, but the rest is what we're going to talk about. Okay, so what were the visions you had, and what I guess how did you create that, and then what role does each of you play?
Sure. You want me to start? Or you want to go? Okay. So I know from my end, I had a notebook about a year prior that I scribbled down. I think it's called a Venn diagram, even though I don't think that's really what I was using it for, where I had this idea of an ADHD centered practice where there would be medication management, resource navigation, case coordination. And I jotted that down. I think I even put like night out for parents.
That's great.
And it's something that I really wish I had when I was going through, the original journey with my own, son and kids in general. And I was like, how can we make this happen? And when I mentioned it to Dr. Lancer and this idea of having patients come to us and not just spending 10 minutes with us in the doctor's office, but doing a proper intake, having someone in pediatrics from the medical standpoint and someone in psychiatry from the mental health aspect, evaluating their child. And then after that evaluation, coming up with a treatment plan, coming up with a diagnosis, and really hand holding the families through the process. A lot of times families come to a provider and they say, here's a diagnosis, here's the medication, or here's a few names or referrals, kind of good luck. Let me know if you
Right.
need anything else. I'll see you back in 3 months, for
Right.
your refill. And we both really felt that was, poor care. And
Right.
it wasn't something it wasn't sustainable for families because they would jump from practitioner to practitioner, referral to referral, school to school, and they were lost. They had no idea how to navigate. So this program really allows families to come and after the initial evaluation, have the opportunity to discuss medication. Many of our families are medication naive, medication ignorant, medication resistant, or want medication, but have no idea how to approach it. So really taking the time to speak with families about the different medications, the side effects, the benefits, the risks, and then setting them up with a plan. Are you working with a psychotherapist? Are you working with an executive functioning coach? Are you working with an ABA therapist? Does your child have extracurricular activities? What school are they in? Do they have learning differences? And really teasing apart the whole child. Are there medical concerns? Do they have poor weight gain? Do they have short stature? Do they have, so many things that go into it? Do they have an OT? Do they have a speech therapist? And we have taken the time, and that's part of what we do, to tease out the process and really make sure that they have the right people on their team. The whole concept of it takes a village. Like I always say, and I said it before, I wish I had this, the whole village. Like I created my own village for my son and my family, but really to have the village and have the support in a way, there's a concept of too many cooks in the kitchen, but I like to say as many eyes on the child as possible. That's all different lenses that we're able to really view the child in and be able to help the child. So that's really what sets this program apart from just going to a psychiatrist or just going to a therapist or just even going to your pediatrician. It's really a hand-holding, all-encompassing process. And we know with ADHD, there's so many comorbidities. So we want to really, Dr. Lancer is incredible at diagnosing and figuring out, what else is going on. So even though it's our ADHD program and we're talking about ADHD today, obviously there's so much overlap where we're able to get the families the support they need outside of just quote unquote, the ADHD diagnosis.
And Dr. Lancer, you had a similar vision as well?
Yeah. So it's all about quality of care, and I liked what I heard, and what she presented was in line with what I wanted to do, and it's been great.
Right. So it sounds like your angle is more from the quality, and your angle is more from the combination of your experience, if I'm getting this right, both professionally and as a parent, that you're seeing like a huge gaping hole,
Yeah,
and really room for somebody to create something that would address or that coordinate all the needs at once.
exactly. And be a liaison, be a child advocate. I still work in general pediatrics and I still do, well checks and sick visits. And so I'm a child advocate across the board, whether it's in a specialist office or, I need something for the patient. But in this specific program, really advocating for the family and the children and being the liaison for families, because that's a lot of it for families is they don't have a voice or they don't feel like they've found their voice and they need help figuring out like what they're eligible for, what they're entitled to, what their privileges of having ADHD, can be in schools and therapy, in the community.
What do you mean by in the community privileges in the community?
Sure, like are there resources? Are there, for example, going to theme parks,
Right.
going to Islands of Adventure, Universal, waiting on lines. A lot of families don't know, if a child has ADHD, you
Yeah.
can actually get their own fast pass, but not knowing that, not knowing what your, rights are and your privileges out there, you'll wait online for 2 hours with your
Right. Right.
child with ADHD and you'll
Right.
go on one ride and maybe all want to leave after that.
Right. Oh gosh. Okay, so what role does each of you play? What's the name of the center, and what role does each of you play?
What name do we have?
So we go back and forth because we just say we're us, just call us. I think we're
Perfect.
the ADHD team, the neurodivergent team, the just call us and we'll help you team. Let us know what's going on. We don't really have a formal name. Dr. Lancer has a private practice, Lancer Health. So that might be how people find us, but we can't say we have any fancy name.
Got it. Okay.
We go by the program.
Start
We
the
want
program.
part of the
Just
program, part of the membership.
The club. Exactly.
nice. Okay. And what role does each of you play?
It's more of a team approach. I would say I'm, of course, the psychiatrist, the taking the history, the diagnosing, designing the treatment plan, and Yaffa is more like the glue that sticks everything together.
The executioner. No, that's not the right word.
That's
That would be for killing. The executive.
Executive.
So what would it be? Executing the plan.
Okay.
What do you say that? It's not executor. Executionist. Is that a word?
No, execution is
I'm not sure. Executive would work, I think.
Executive. Perfect.
Executive.
I get everything done. I make sure the families are taken care of. I make sure they are accountable in a healthy way for the tasks that I've given them. Call this person, call that person, do this, do that. What do you think about this? So yeah, I mean, we do the visits together. Some visits, he'll do alone. Some visits I'll do alone. But when I say together, he's always in the background, or I'm, a phone call away. We work together. So whether he's doing the medication management or I'm, creating the plan from what he's established, where it's a teamwork.
Right. Amazing. So at what point in people's journey are they usually finding you? Are you their first call? Or are you like they've tried so many things, and where have you been all along? At what point are they finding you?
We're either the first call or the last call. We're either, I heard you're the best, I want you right away, or I've tried everyone else and I heard you're the best and I want you.
Right. How do people find you in general?
I would say a lot word of mouth, parent to parent. You have to go to them. They really helped me. A lot of therapists, so OTs who are usually seeing the kids originally, right? We have like the progression of how kids usually get to psychiatrists. So they typically start with OT,
Right.
and then, they will transition to a speech therapist or a social skills groups until they finally come to the point where they've tried other alternative methods, and they'll come to a psychiatrist. We try to encourage families to come to us regardless if they're interested in medication or not, because although it's a psychiatric practice per se, it's not really only that. But yeah, I would say OTs, rabbis in the community, schools, really, really anywhere, honestly. I mean, it really depends on the needs, who they're connected to, and who they're coming in contact with.
Got it. What are the common comorbidities that they're coming in with? You mentioned comorbidities before.
Um, oppositional defiant disorder, DMDD, OCD, anxiety, depression, bipolar. I mean, anything really. Sometimes, we get parents that say, my child has ADHD, and it turns out he has something completely different. And sometimes it's the other way around. I'm worried my child is psychotic. I'm worried my child is this and that, and it's not. It's ADHD.
Right. So what's the what's the range of services that you either provide, or the range of different providers that you send to? It sounds like there's a lot.
So as far as what we do, we are under the scope of psychiatry. So we provide the psychiatric evaluation, which yields a diagnosis. We give a treatment plan. We prescribe medications, and we make recommendations and referrals to other professionals. And then the case coordination piece, of course, which is piecing all that together and executioning it.
We kill it. We help them. We help them kill it. We got this.
We're the Ghostbusters.
All right. Oh, excellent. That should be your name. So in house you do the psychiatry, and then from there and then you're coordinating with other professionals.
Yeah, we do a lot of the coordination. So the other referrals that we refer out to would be, any of the therapists. So OT, speech, physical therapy, and then ABA therapy, executive function, executive functioning coaching, psychotherapy, play therapy, extracurricular activities, equine therapy. I mean, we're really working with the families, and because I have expertise in pediatrics and also the personal journey,
Right.
I have the ability to help families navigate and figure out what their needs are, and also provide that support, and obviously from a medical standpoint, also, making sure there's nothing organic going on as well. But, part of what makes us unique, or I think what makes us unique is, I think at the end of the day, and I always say this, anybody can prescribe and anybody can treat and anybody can, do therapy, and they're really good at it. It's not to minimize it. But when you go through something, or you're going through something on a day-to-day basis, like my family's come to me and I'm like, I get it. I know, I'm not divulging who else in my family has ADHD. My son is the only one right now who gives me permission. But, there are enough people that I'm, connected to and love all day, every day, that allow me to, help families navigate. And a lot of times they'll say to Dr. Lancer, well, can you be my therapist? Because he is trained in therapy. Or they say to me, well, can you help me make a behavioral plan? And, I'm a big believer of, what you know, and you know what you don't know. And, we try to stay in our lane, but definitely we have the ability and the capability to do some in-house, work as well, without calling it, treatment, but really support, giving that support.
So yeah, I would say what sets us apart is we collaborate a lot with all the other professionals, whether it's the mental health professionals or the OT, the PT, the ABA, or the medical professionals. We have kids with seizure disorders, we have kids with genetic disorders, metabolic disorders, and so we really, part of our program is putting together this team and having a meeting with everyone and getting everyone on the same page.
What are some, I guess you mentioned a very wide range of different professionals. What are some professionals that you found to be helpful for kids with ADHD that the average parent or listener might not have realized could bring benefit to them? Like you mentioned, equine therapy.
I think it's, I think it's one of those things where it has to be, tailor made to the child and to the patient. It wouldn't be right to say this is good for this, or
Yeah, but I
Right. Yeah.
think I think really our goal is really trying to find out what the child is good at, what they excel in, what they can be successful in, and trying to figure out how to make that a real modality. So even like with horse therapy or with art therapy or basketball, whatever it may be, figuring out, like, I think parents assume that they always need something structured. Like, I need a therapist, and it's true. Psychotherapy is incredible. It's super important to explore feelings and emotional regulation. And ABA therapy is super important to understand what behavioral modification is. I think I'll get back to my other point in a minute, but I think parents a lot of times misunderstand. And I'm not going to talk as an ABA therapist, I'm just going to talk as my own experience with parents. I think they don't really understand all the time the benefits of it. And I think our biggest challenge has been matching families to the right therapist. And when I say challenge, it hasn't been challenging, but that's the biggest task for us, is really it's a relationship at the end of the day. So educating parents and saying, ABA therapy, you think of it as one thing, but really, if you find the right fit and you find the right personality, it really can be very helpful. I think parents minimize extracurricular activities, in my opinion. I think that they're not necessarily using or utilizing that as a form of therapy. So I spend a lot of time educating families on, I always make a joke like basketball in the evening is my son's last dose of medicine. Like, it really putting them in a position and a scenario environment where they feel successful. That is therapy for them. That is, quote unquote, medication management, or, helping them to regulate. So I think that's the, not like the secret, but I think if I had to explain to parents something that they wouldn't necessarily think of on their own, it would be how important, extracurriculars are, or not even hobbies, keeping your child busy. A lot of families are so exhausted. So after psychotherapy, they're sitting on the iPad, or after ABA therapy, they're, just chilling. And not that there's anything wrong with that, but I think that we don't necessarily maximize. And it doesn't even have to be a fee. It doesn't have to be something that you're paying for. Even just having the tools set up in your home or outside your home to be able to have the child stay busy, I think is, more valuable than parents realize.
I got it. Are there any other, I guess, formal interventions that, even though they're not for everybody, are just things that might not be on a parent's radar screen at all, that
Yes.
they should be aware of?
Yeah, so I would add to that, ADHD, if we're only going to talk about ADHD, is multifaceted. And so, are we dealing with behaviors? Are we dealing with emotions? Are we dealing with a hyperactivity? So let's say it's behaviors, so then we would seek out a behavioralist. If it's something that the parenting needs help, so we would seek out someone that could help with the parenting aspect. If it's hyperactivity, we would seek extracurricular activities that could get some of that energy out. If it's emotion, if it's the rejection sensitivity, we talk about psychotherapy. So it really is targeted.
I don't think there's, I think what he's asking is there like something that we've found that,
Is there secrets?
yeah, is there a secret? There's no secret. I think that's the hardest part for
The
parents.
secret is
The secret is look
finding.
what's right in front of you and utilize the amazing, modalities that we have. Yeah, we could talk about alternative modalities. We have families um, who like acupuncture, who like craniosacral therapy. And we have tremendous respect for those modalities. And if it works for a family, then we're extremely supportive. But I think that families need to utilize what they have and what is available, and utilize it to its best, to their best ability. I feel that a lot of times families are looking for like that fix or that secret or that specific thing that is helpful. And a lot of times it's really
I'll
very
tell
simple.
you. I'll tell you the secret. The secret is finding someone that cares.
Tell me more.
That's. I mean, that's pretty much it. Quality care. It's very easy to find someone that'll give you a diagnosis. It's very easy to find someone that'll give you a prescription. It's very easy to find a speech therapist, an occupational therapist. But finding quality people is not easy. And finding people that care is you need to put in a little bit more work.
And care meaning, and I guess what does that look like? The implementation of care, other than the sense of emotional support.
So I've had people come to me and say, you're the first doctor that I can just call on their cell phone. You pick up the phone, or it's so nice that I know that if something goes wrong, if I have a side effect, I don't have to schedule an appointment for 2 weeks from now. I don't have to call a receptionist.
That is
You're
nice.
I think care also looks like, even with the other disciplines, I think care looks like parents receiving feedback. I think a lot of our families who come to us and are looking for changes, changes or therapeutic changes, will say, I don't even know what they're doing in a certain modality. I don't know what they're doing in speech. I don't know what they're doing in occupational therapy. Could you call them and find out? And I think we really try to work with people who collaborate as well, so that there's feedback to the parents. Because I think a lot of it for families in terms of care is just not being informed and not being in the know, and they don't know what to ask the therapist, or they don't know what to ask us. So being listened to and being validated, even by therapists outside of just emotional support, but actually knowing my child is making progress in this area in OT, my child's making progress this area in ABA. I think for families that's extremely valuable, and that's what care is. It's not just, your child came in and we hung out the whole time and I emotionally supported them, but I'm actually helping your child move from point A to Z.
Right. Yeah, that's a big deal. They're not.
Uh-huh.
Sometimes people have expectations about what's supposed to change and what's supposed to happen, and they're unrealistic, or sometimes they're not optimistic enough, and they're like,
Right.
"Okay, I guess I'm signing up for this for the next 3 years. Let me know what happens."
Exactly.
So,
So I think we really try to empower our families, like know what's going on, see so that you don't feel in the dark and you feel like, there's movement or there's not movement and we need to try something else. Don't just pay people because it's an activity for your child and you need your child to be busy.
right. How would you describe the support that parents need through this process?
I think that it's very overwhelming when you have, especially a behavioral child. A lot of our families, like we say, are under attack,
Right.
and a lot of times they come to us with a neuropsychological evaluation or a psychoeducational evaluation, and it's like a packet of a lot of recommendations, and so it's very hard to follow recommendations when you're under attack. So um, you know, I think they really appreciate the hand holding.
One of the things we do in our practice is, because Dr. Lancer is an adult psychiatrist also, we actually take care of families. So we have many parents who are under his care, um, psychiatric care. And most of our families, the parents are seeking their own help. It's almost like a prerequisite for us. In order for your child to get better, we
Right.
need you to be taking care of yourself. So the support that parents need outside of the support that we give them and the love and the care that we give them is really, how are you taking care of yourself? Do you, if you do or don't need medication, that's, their personal journey and business. But if you do, we're able to help you with that. And if you don't, how can we find you somebody, on a regular basis who's giving you the support you need? What are the activities you like to do as parents? How can we help, you take better care of yourself, fill your own tanks? So I think we spend a lot of time with parents as well, encouraging them to take care of themselves. It's really the only way our program is effective. I mean, obviously it can be effective in that we're happy to treat kids, but unless the parents are really ready to take care of themselves and open to that feedback, it's really hard for the child, because a lot of these families, the parents have ADHD themselves, or anxiety, depression, or just feel overwhelmed, like Dr. Lancer was saying. So I feel like, um, reminding parents, hey, you have a voice, you're a human being, you deserve to take care of yourself. And when you feel better about yourself and you're sleeping and you're eating and you're exercising and you're doing what you love, what you did when you were 15 and you love that hobby, you'll feel much better or more calm about helping your child to be successful.
Right. If a parent is feeling guilty about that, what do you want them to hear, and how important is it for them to do this, not only for their own well-being, but for their child's well-being?
That's a great question. I feel like we can all relate as parents to that guilt. I feel that when you are able to have a mindset shift and you realize that that guilt can be turned into an asset for your child. So in fact, I'm taking care of myself. It's a real level to be able to get to. I take care of myself because I love myself. That's a whole separate conversation, right, for parents.
Right.
But if we're not at a place where we can say, I love myself and I want to take care of myself, but I love my children, and it's important for me to take care of myself in order to take care of my children, I do feel like that takes some of the guilt away. At least I know, as you know, as a parent myself, through the process, knowing that it will help and benefit my child is much easier than, oh, it helps me. It makes me feel good. That's almost like a secondary thing. It eventually, God willing, it will be something that's just as much a priority. But I think that, you know, as parents, hopefully we prioritize our children, and sometimes, you know, we prioritize them over ourselves. And I think, you know, having that healthy balance of both of us being a priority is really our goal. But I think that guilt can be turned into, it's not really guilt, it's actually imperative to take care of yourself so you're able to help your child. And I think that helps reframe self-care for them.
Right. That's great. How much more effective will the parent be by taking care of themselves?
Yeah, it's a game changer. Think about it. When you don't sleep, how do you feel just taking care of yourself? When I don't sleep, I'm exhausted. I'm irritable. I don't want to talk to anybody. I want to go back to sleep. And now I'm responsible to take care of another child. Forget it. Like, good luck. So I feel like it's going back to basic living, sleeping, eating, like I said, taking care of yourself. You're going to automatically see the difference. Because you're going to feel good. You're going to feel better about yourself. You're going to feel like you have more energy. And when you have more energy, you can take better care of your children. It's easier to navigate behavioral challenges in the home when you have something in your tank. If you have nothing and you're driving on nothing, then not only can you take care of them, but the child perceives that. And then they can use that to their advantage. Mom's so tired, so I can get away with things, right? Mom's so tired, so I can do whatever, I can say whatever I want. So I mean, it's imperative to take care of yourself in order to be able to take care of your children. Whatever that means on your own level.
Do you interact with the schools at all?
All the time.
What support do the schools and teachers need?
All of it.
I think they need. I think the biggest thing for schools is knowing that the family is invested and the family cares. I've seen many times where if the school knows that the family has a team or you know, has invested in the care of their child, and outside of maybe what is the norm, because this child is requiring more support, I find that the schools are much more comfortable working with the families because they know that they have support and that they have people to go to and resources. I have teachers that call me and reach out to me. Every family that wants me to be part of the school, I'm on a team chat with the teachers, with whoever the therapists are. So I see in real time what's going on in the classroom. Sometimes I feel like the third parent. I'm like, good job, Johnny. So proud of you. I love that picture you did in school also, but I'm really, really involved. And I think it allows the schools to relax a little bit. Like, okay, it's not just us. It's not just us and the parents, but it's us, the parents, and the whole support team. Really, what more can they ask for? So I think just knowing that is for sure a good start. And then many times I have teachers who reach out to us and will ask us for specific, recommendations like, hey, I noticed that, you know, Tim was doing this today. Have you noticed that? Is there something that's going on at home? Like, obviously we have complete medical release for the families that allow us to talk. We're being the family liaison. So I might say, yeah, this is what's going on, or it's a good idea to speak to the parents, get a sense of what's going on at home, and, then come back to me and we'll talk more, or, brainstorming ideas with them. So that's definitely a big part of what we do. School observations, sitting in on meetings if need be. The job is endless in a positive way because there's so much opportunity. Every child is their own world, and figuring out what the schools need, is what we do,
Right. Amazing. So it sounds like you're really hands-on in terms of even if the teacher needs a hand with a particular, behavior in the classroom, or a way to reach the kid. It sounds like you're there even for that level of specificity.
Yes, absolutely.
Did they ever just unload their frustrations? Because I can imagine that happening.
They do. I I'm truthful with all my parents, and I let the parents know that our job is to collect information and be their child's advocate, not to talk badly, God forbid, about the families. And so I'm very careful when a school or a teacher wants to unload. I'm happy to validate frustration, but I will never engage in putting the child down or putting the family down in a way that would compromise my care for the child. But yeah, I mean, we're human. So teachers definitely are frustrated by the process, but it really gives an opportunity for us to help them understand kids with ADHD and help them shift their own mindsets as to how it can be an opportunity for a change, whether they're interested in the change or a change in relationship or a dynamic, and really giving them the support, to be able to navigate instead of just being like, yeah, it's a lost cause. I totally hear you. This, student shouldn't be here anyways. Like, it's very easy to do that. I mean, like I said, we're human, but that's my goal is to keep the child in mind. Like at the end of the day, even when we have parents who are more challenging, and usually it's because they're going through their own things, our goal is to take care of the child and make sure the child is getting their needs met and advocate for them. And we would never do anything that would compromise, that child's care.
Right. It sounds like even when the teacher is expressing frustration, you can sort of turn that lemon into lemonade in a manner of speaking.
Exactly.
Yeah.
It's always an opportunity, always an opportunity. And kids with ADHD, they don't mean to do whatever they're doing. Like my father always said, kids are born to want to succeed. If they can succeed, they will succeed. So if they're not succeeding, then you have to look at why they're not succeeding, because kids are resilient and kids want to be successful. They want to please people by nature. Like they're innocent. They're trying to do the best they can with the tools they have. So to make them out or to villainize them is really, that's why we went into what we do, because we want to change that perspective and perception of the outside world.
Right. Awesome. Do you ever get pushback from the school?
Sure. We have 20 students in the class. He's not the only one. We've tried that already, or it's too complicated. So we definitely get that. But we try to, again, validate. And I'm a big believer of like, I'm going to give you the tools. If you want something to change, then it's going to take work. So you can't complain and then not want to change. So it's okay if you don't want to change, but then, you don't have to complain, about it. So
Right.
I'm a big believer. If you're complaining, it means you want help.
Right.
Otherwise, seek other ears.
Right. I mean, this is already happening, so now we can complain about it, but it won't make it not happen anymore. It'll still be happening. Right.
I don't have a magic fix for you. I have hard work. And if you're willing to do it, it could probably, and I actually explain to teachers, I'm like, most of the work that you're going to do with this child can actually benefit the other 20 kids in the class. What child really wants to sit in a class behind a desk? I mean, it doesn't matter if you're, neurodivergent or atypical, like most kids are more excited by, creativity.
Right.
Or incentivizing. Like you can't go wrong really, even in a neurotypical setting. Sometimes we also realize that the school's not a good fit for the child after having a year of speaking to the teachers. And that's actually something that we help families do as well. We'll have families, sometimes, unfortunately, we have cases who, are families that come to us already. The child has been kicked out of school. They're not allowed back unless XYZ. But then we have families that it's just not the right fit. And we spend time, explaining that to parents. Like, I understand that it's very important for your child to be in this type of setting or this type of environment. I understand you live in a certain community, or these are these are the expectations of the community, and these are the expectations you've set as a family. But if we really looked at the different school options, there might be a better fit for a child. So we actually spend a lot of time on that school counseling also for, families, to help them really make sure their child is in the best place. And again, this is where the parenting comes in. Like, you're not alone. I have my own children. I know what it feels like to not have a child in the, mainstream school or the school that everyone wants to be in. And so I think that is also very comforting to them. Like, okay, I'm not alone, because parents and families who have ADHD, or have it in their family, it can be isolating,
Sure.
depending on what's going on. And I think just having that support and knowing that you're not going to be the first to take your child out of a mainstream school and give them the support they need. Like, you won't. And even if you feel judged, those people are looking at you and they're like, wow, I wish I was as brave. We know
Right.
this. This is not a secret, you know?
Sure. Yeah.
Um, so, we try to do leaderships and workshops for schools, and as much as the school will allow us to come in and give educational, talks or Q&As, we really try to spread the light so that it's not just in working with a family, but everybody ends up benefiting from it.
Right. Wow. Do you ever have to navigate when there are differences of opinion, either between the parents themselves, between the parents and the school, or the kid's not on board? How do you deal with that? I assume you do,
We deal with it.
right? What's it look
Well,
like?
on several instances, we've had, the child is struggling, and the mother is struggling because the child is struggling. The mother is, asking us, please, can you give him something to help him? And the father is, against medication, a certain medication, and maybe the father was on a stimulant before and he had a bad experience with it, and he doesn't want his child to go through that. And so, like I mentioned before, it takes someone to hear these parents out and listen to their concerns and assure them that, we're here throughout the process, and we'll, and if anything goes wrong, we're here to fix it. And we've had great success with, with helping people.
I think our one of our hardest populations are teenagers. I think that a lot of times, because they're developing their own autonomy and independence, and they can do it without medicine, they don't need medicine, everybody else needs medicine, it's not them, right? I think what I have found to be successful is, instead of talking to the child through the parents, like, just talk to the child, see what's going on, figure out, what's bothering them. Is it a side effect? Is it a stigma? Is it, and then what I have done in the past, and Dr. Lanter has done this as well, but what I have done with some of our patients is, I'll say, just call me. I'm not going to ask your parents how it's going. I'm going to check in with you. At the end of the day, you told me that you were dizzy or nauseous. I'm going to check in with you at the end of the day. I want you to pay attention to this, this, and this, and then we'll check in together. And I think them just knowing that we're not just forcing them to do something, or it's not just because their parents think they need it, but really getting down on their level and creating that relationship with them. Because really, that's what it's all about: creating the relationship, creating the trust, helping them understand that we care about them, and that this is just a tool, for them, that we want to see if it works. Like, a lot of times I'll say, we're just going to see if it works. We're just going to see if it helps you. You're going to tell us if it's helping you. You're in charge of letting us know, and kind of empowering them to feel that way. The other issue we run into is kids who can't swallow medications. Obviously, I mean, there's many different ways to take the medication, but I think that's also something that we found, that a lot of times parents will just like give the child the medication, or they'll like be like, here, I'm sprinkling it on a spoon, take it. And I'm like, no, you have to make it sweet for them. Find out what they like, find out what they want to put it in, find out what would be fun. You don't have to put it in applesauce. You can put it in whipped cream. You can put it in Nutella. And I try to say, like, make it fun so that there's not that resistance.
Amazing. It sounds like you're really finding them and you're really addressing their concerns also.
Exactly.
Swing things over a little bit. What support comes up for the siblings?
Well, I mean, it happens all the time where, we start with one child, and then, the family really appreciates what we're doing, and they're like, can you help out the other children? I know we've had people come and say, I have a family of X, can you help us all, including the parents? And so, part of what we do, a big part of what we do, is we do the initial evaluation, both of us in the family's home. And as part of that, we try to observe the child in their home environment and how they interact with their siblings, and we try to take everything into consideration.
I think also I spend a big part of supporting parents and helping them understand. I mean, I make this joke. I don't know if it's really true or not, or funny or not, but I say, your child with ADHD is going to be fine. Like, he or she's going to be fine. It's the other siblings that we have to really worry about or be concerned about, because the child with ADHD is getting the most attention, whether it's negative, whether it's positive, but they are our lives are it revolved and involved with them, you know? So I think helping parents understand that many times siblings need a safe place to be able to vent and talk about their feelings, and making sure that they have their own therapist or their version of therapy, whatever that might be for them. Again, extracurricular hobby, a good role model in the community, a safe person that they want to speak to, a big sister, you know, someone that they have. No child should be left behind, you know, even if they don't have ADHD. So I'm a huge believer in siblings having the support they need and families finding the time to be able to give that one-on-one attention to the siblings, whether it's after the child with, you know, the challenges goes to sleep, whether it's setting a certain, you know, a specific time. I know the age old, take your child out once a week, just spend an hour with them. We're all busy. It's not always a reality, but maybe making an effort to put your child to sleep, you know, even though your daughter's 13, actually physically going in there and talking to her for a few minutes. To me, it's about quality, not always quantity. So if they're getting that quality attention, you know, then it's easier to live in a home with difficult siblings. We're in the process of starting support groups as well. And one of my children said to me, Mom, I could run the support group, the sibling support group. And I was
That's
like,
great.
perfect. You can run it. And that's how we empower them, right? Through humor. We do a lot of humor without putting the other sibling down. We try to live with a lot of, you know, joking and humor where something is said that's not really nice. We try to make it into a joke, not in front of the sibling, but, you know, behind the scenes in our own personal relationship, so that we kind of make it a little bit lighter in the home. Not as much tension.
Awesome. What is the standard timetable when a kid, a family comes to you before things are, I guess, stable enough that they're in a routine? Meaning you have a medication regimen or not, or a therapist or not, whatever they decide to go with. How long does it take until they're, I guess, up and running?
I think it really depends on the child again. We've had children where they start the medication, and the next day the mom is calling us excited. Wow, he's been so great. He sat through dinner. I've never seen him like this. And we've had times where it takes maybe 6 months, maybe a year by the time we find the right therapies, the right medicines, side effects, interactions. Sometimes people are not a good fit. Sometimes
It's a
it
compliance
yeah, yeah,
issue.
compliance, or it's a insurance issue. Finding the right people, the right places, traveling. It takes time.
I would say it takes about 3 to 6 months to really understand the child and the family. I think anyone who says they can treat in less than that should spend a little bit more time getting to know the families, because I think that's usually the time where you see a good chunk of the school year or the summer, a good part of chagim or holidays, or, you know, dynamics. Mother becomes pregnant, a child is born, they move. Like, that is a good amount of time that you really get to know the child. In that time, those 3 to 6 months, many times we're able to do everything we're trying to do, you know, get them the right support. And many times that's just when we get to know the child and we're like, okay, now we understand what's really going on. You know, this is our plan for the next 3 to 6 months.
Right. During that process, when they're figuring things out generally, and maybe specifically when they're figuring out which medication is going to work for them, what's that process like for them? And for somebody who's listening, what do you want them to hear about toughing it out while that process is going on?
It's all worth it in the end.
I was meaning it's not fun, but they'll be glad in a few months.
Yeah, it's a process, it's a journey. That's what we're here for. I had a mom recently come to us and say, we've already tried X amount of medications. Like, I'm just so frustrated. And for me, just being able to say, I know it must be so difficult. You know, we're here for you. And we're finding the right, you know, tools in the process. Let's focus on the other support that we're getting so that we can, you know, we try to really help them to navigate it. But that's really what sets us apart from other practices, because most of our families, if they were in another practice, they would be off the medication already. They'd be frustrated. They'd be off. Oh, it's my assumption only because I see how much, effort and work we have to put into supporting them through the process. I just can't imagine, if someone doesn't have the time to do that, how it's happening. So I think really just saying to them, trust us, we're going to, and we're not deceitful. Many times the medication might not work, and many times there might not be an exact medication, and then we have to talk about what other support we can use, how efficacious or effective the medication is going to be, and how much we have to rely on other recommendations. But they won't know that unless they stick with us and to it. That's part of the journey in the process.
Right. How common is it for somebody to not be responsive to medication at all?
I mean, it really depends on, again, it depends on the patient, it depends on the comorbidities. Is this a child with co-occurring autism that may have a paradoxical reaction to some medications? It really varies. Are we going to uncover an underlying OCD, 3 months into it? Are we going to learn something from a teacher that we haven't heard from before about a behavior that no one has known about? It really, again, varies.
But is it a thing you see, pretty often, or it's very, very rare to see someone who, ultimately the meds aren't going to work for?
I think work is a relative term. I think we have to define what work means.
Yeah.
Families and their expectations might think that work has a certain definition. We might have a different definition. Teachers might have a completely different version of what works means. So I think effective, most of our patients, the medications they're on are highly effective. Now, what else are they doing, or what other resources are they utilizing to help the medication to work at its best? Because we really use medication as a tool for them to be receptive, to be able to learn skills and to be able to learn how to emotionally regulate. And through that consistency of those patterns, we hope that they develop that, outside of the medication. So I think that all our patients that are on medication, it's been effective. How effective? I think it really depends on the perspective and the perception of the players involved. That's the honest truth.
Okay, I mean, Scott?
Yeah, we don't keep children on medication if we don't think it's effective. Like, we're not just like, yeah, no, stay on it. Maybe it's working. So, the answer is all our patients, the medication is effective. How effective? It depends who's looking at it and, what behaviors they're looking to address.
Right, I guess I just mean, how common is it that you try, different medication options, and ultimately you decide that medication is not for this particular individual? Is that a common thing to happen?
Well, usually, if that's the case, then that's something that we kind of pick up on during the evaluation, where somebody might come to us and they say, "Oh, my child has been diagnosed with ADHD, and they've been on this stimulant and that medicine, nothing's really worked." And at the end of the evaluation, we might say, what we're seeing is not really psychiatric in nature, but behavioral. And so, a medicine is not really going to fix it. Something that's behavior. You need behavior modification.
Got it. So if I'm understanding correctly, you're saying usually if medication isn't effective,
Mhm.
it's or effective in the sense that they're not reacting to it. It's because the issue isn't a psychiatric issue at all,
That could be one of the reasons. Yes.
right? Are there other common reasons?
Compliance. Are you taking the medication at the right time? Are you taking it? Are you skipping doses? Are you utilizing any other is the child in psychotherapy? Is the child, using behavioral modification, because the medication is only going to take us thus far? So I would say compliance. Most of our patients, like, I'm thinking out loud, most of our patients, they're doing well on the medications, whether it's the first medication they tried or the fifth medication. If it is psychiatric in nature, we have been successful finding a medication that, will help them to be able to function better. I think when I say works, that's really what I meant. How well are they functioning with or without the medication?
Right. Okay. Is there a message of hope you'd like to leave our listeners with?
There are people out there that care.
Your child is lucky to have you, and when you put all the work in that you are, and you mix that in with a lot of love, your child will know that, and they'll look back many years later and say, my parents did the best they could with the tools they have. And keep doing what you're doing, because even though it's difficult and it's a journey, your child needs you, and they appreciate you more than you know.
Awesome. How can people get in touch with you?
They can call my cell phone. It's 646 363 or they can send me an email, lancer@lancerhealth.com, or send Yaffa an email, yaffa@lancerhealth.com.
Okay, awesome. Anything else you wanted to mention today?
No, we're just so grateful that you allowed us to come on and to, share our experiences. And if anyone has any questions, they can feel free to reach out to us.
Thank you. Okay, Dr. Lancer and Yaffa, this was amazing. Thank you so much.
Have a great day.
Thank you again for listening to this episode of the ADHD Heroes podcast. For questions about the podcast, you can email us at adhdheroespodcast@gmail.com. Also, for sponsorships or to share your story, your ADHD story, you can also email us at the same place, adhdheroespodcast@gmail.com. To be in touch with me about ADHD coaching, writing, or speaking engagements, you can email me at rsreichadhdcoach@gmail.com. Be sure to check out my website, rsreich.com, adhdcoach.com. You can follow me on LinkedIn, or you can check out my blog on nefesh.org. Check out my blog there under my name. Important disclaimer: podcasts are great, but they do not take the place of mental health help or medical help. So if you need help with mental health or need a doctor, be sure to be in contact with some of them. Please, if you like this show, please rate, review, and share with a friend. That's how these things get out there. Thank you again for listening, and thank you to our producers at Pretty Easy Podcasts.